Dr. Rachel Pope is the Division Director of Female Sexual Health at the Urology Institute, University Hospitals in the Cleveland, Ohio, and a passionate advocate for women's health. She's the founder and host of Our Womanity podcast, and a trusted podcast delivering evidence-based insight on perimenopause, women's sexual health, and reproductive wellness. Dr. Pope is also the Chief Medical Officer and co-founder of Menopause, a line of non-prescription supplements designed to meet rigorous scientific and consumer standards. Every MIM product is grounded in a research and developed to support women navigating menopause. A Menopause Society certified menopause practitioner and fellow of the International Society for the Study of Women's Sexual Health, ISSW. Dr. Pope combines clinical expertise with global impact. She leads the Global Health Program in urology, fostering collaboration between urologists and gynecologists in the US and in multiple centers across West and East Africa. And she's also an NIH-funded researcher and prolific author, and has published over 60 peer-reviewed scientific papers and books, including Sex, Love, and Menopause, sharing knowledge and empowering women to navigate. And I had the privilege of interviewing her today, and I know that you are going to find this episode very useful, and I hope you find a rich experience. Please enjoy our conversation. Thank you so much, Rachel, for coming.
Absolutely.
I have been waiting for this
Aw.
since I heard about you and
Mhm.
all the work, the amazing work you do.
Thank
And,
you.
women health is important and not talked about. And I don't
Yes.
know a lot of people who do this. And
Mhm.
I really, really appreciate what you do. So if you can introduce yourself to our
Sure.
viewers, that would be awesome.
Yeah, so I'm a gynecologist and my passion is really in gynecological surgery. So my work after I finished my OBGYN training where I learned how to, manage labors, be there for deliveries, to do C-sections, to do hysterectomies, pap smears, all the full gamut. I really specialize in obstetric fistula repair. So helping women who had severe childbirth injuries, mostly in very underserved parts of the world and very marginalized women who couldn't get help during their deliveries. And that became my surgical practice. And I love that work. But what I've seen as I've come back to the US, that there are these issues that women face that are just as serious as obstetric fistulas and so taboo as that those women were experiencing there. And I'm seeing them here in my own home country. And those issues, right, are women's sexual function, perimenopause, and menopause. And so now I still do surgery. I still do fistula repairs here in Ohio, but I also see women for sexual function issues, for cancer survivorship, and menopause and perimenopause.
How amazing. And you said you were in West Africa. And
Mhm.
could you say a little bit
Oh, sure.
more about that? What was your experience like?
Yeah, sure. So I have spent a lot of time in West Africa in a few different countries, but actually I was living in Malawi in Southern Africa.
Yep.
And so I was there for 4 years. The first 2 years was my fellowship training where I was learning how to do these surgical repairs. And then 2 years after that, I actually was fortunate enough to be given the opportunity to be the medical director of the Fistula Hospital. And so while I was living there, I was invited to a few different hospitals throughout sub-Saharan Africa, including West Africa, to help with fistula repairs there too. And so I would say it's a condition that it's just not really recognized very much in the US because we don't have that many women who have this problem, especially because we don't see it happening from childbirth anymore, but it used to in the 1800s and the early 1900s. We did have women who got fistulas from childbirth, and then rarely it happens now. We see it from radiation damage or from surgery damages here. But abroad, unfortunately, especially West Africa, Southern Africa, and East Africa, we do see it quite often because a woman needs a C-section and doesn't get one in time. So there aren't that many of us that specialize in vesicovaginal, rectovaginal fistula repairs. So I was invited to a few different hospitals, and I still travel to West Africa, to Senegal, Sierra Leone, Cameroon, and I do fistula repairs there.
That's really amazing. And
Thank you.
what was your experience of the people, the culture?
Yeah, I mean, Malawi was kind of where I could speak the most about just for spending the most amount of time there. And I had a very special experience. People were very warm, very inviting. I knew I was a foreigner, but I don't feel like I was always treated like a foreigner. People were very respectful and want to be inclusive. I feel like it was just a very good experience overall. I loved my work and I loved the patients that I took care of.
That is so awesome. I mean, I've never been to that part of Africa,
Yeah.
but
Yeah.
I am from the East Africa, so
Right.
I was curious. Next time, maybe when you go, you can call me.
Absolutely.
I could join you. You never know. I don't know how to
Absolutely.
repair
That would be
fistula, but
amazing.
hey, you can put me in your luggage.
Oh,
Yeah.
it'd be lovely to travel with you.
Yes, I can be a funny companion, maybe.
Yes, absolutely.
Right.
Absolutely.
So this topic, I mean, coming back, you said you were doing something
Yeah,
also a taboo in Africa. They don't talk
correct.
about these things. I know about it because I was working with, when I was in Eritrea, I used to work with international nonprofits like
Oh,
NGOs,
okay.
we
Yeah,
would call them. And I would hear about that,
right.
like awareness raising and stuff like that. But it's not something that we talk about. It's a taboo.
Mm,
And then you come back here and there's another taboo. What? We have that?
exactly. Right, the parallel is amazing. And
Right?
I think that's why, I mean, I feel like I have this US practice and I have my international practice, but the parallels are very similar. And I feel like it's all about making the stigma go away and normalizing the medical and the physical things that are happening to women,
Yeah.
talking about it. So I'm so glad that we're talking about it today,
Please,
right?
let's
Right?
talk about perimenopause and
Yes. Yeah,
menopause.
absolutely. And the same exact like expressions I would see on people's
Yeah.
face. In Malawi, I would see a young woman coming to our hospital thinking that she was alone. She was the only person in this world experiencing what she was experiencing. She was incontinent of urine and she had been told it was her fault and there's nothing that she could do about it. And then she would walk into our ward and see 30 other women who had experienced the same thing that she had and had just had surgery to fix it. And that there was this hope and that what she had was a physical, medical issue that could be fixed medically or surgically and that she wasn't cursed and she wasn't the only one. And it's the same expression I see on women's faces when we do menopause retreats and they're in my office talking to me about how alone they feel, how they don't feel like themselves and they blame themselves and they may not be aware of what the treatment is or they think they can't have treatment. And then we bring them together with other women and we're like, look how many other women are experiencing this too. You are not alone. And this is a medical, physical situation and there's treatment. It's a crazy parallel to me of how much women put up with and how much, the taboo of talking about these things keep women from getting care.
Why do you think it is taboo? I was very surprised to learn about it. I learned about it because of my own experience. I didn't know what was going on with me. I knew that I was having the symptoms and my behavior changed. And then when I found out, I was very surprised. Why,
Yeah,
why is this not talked about?
yeah,
And why do you think in America culture now, we have a lot of knowledge, we are a free country. Why
right.
do you think is it a taboo?
So my elder sister kind of put it the best, was she told me that, if we're not allowed to talk about periods, why would we talk about when they stop? Right. So, like, from the very beginning, we are taught that we can't talk about what's happening with our bodies and that there are certain things that maybe you could ask another woman questions about, or maybe somebody will give you some information, but you really shouldn't talk about it and you really shouldn't ask any other questions. So it is this secret to go through your cycle, to go through symptoms of your cycle. We could talk about endometriosis, we could talk about premenstrual syndrome, all of these other things that happen around a woman's cycle that are also shrouded in taboo. But then it continues to just extend through perimenopause that if you never talked about its existence, then how can we talk about when things change?
It's surprising to me. I think this is the first time maybe I thought about it. I didn't know girls in America also don't talk about uh, periods.
Mhm.
I
I
know in
think,
Africa because I was born
right.
and grew up there.
Yeah, I think things are starting to change. I know of women or friends who've told me they've had like period parties for their daughters, and I see the social
Period
media
party.
ads. Yeah, exactly. Like welcome to
Period.
womanhood, or they get girls together to talk about what to expect. But from my own experience, it was just health class. And, my older sisters bought me books because they didn't want me to be in the dark as much as they felt in the dark because my parents were religious Christians and just didn't talk about it at all. And, not to disparage them, but that was their culture. And so I don't know if it's the religious culture that we see in America that keeps women's bodies secretive, but I think that's probably part of it. And that just becomes, even if you're not religious, that culture ends up pervading through so many other aspects of American culture.
How is premenopause understood and discussed in other cultures? While comparing, the US, especially among Black and Brown women, because you have the experience with
Mhm.
all women, I was
Yeah.
wondering what's the difference?
So I have yet to see a culture that is really open about perimenopause. And I could be wrong because, I don't know everything, but I love learning about cultures and I love learning about women's health and cultures. And when I was a college student, I studied anthropology and my area of focus was on birth. And that's actually how I ended up learning about obstetric fistulas. But I loved learning about births in other cultures. And there are textbooks. Like there's a lot of books out there about births in other cultures and the rituals that people partake in and the traditions. And we think that we don't have rituals and traditions in the US, but we do. Have baby showers. We have, like meal trains. We have all of these things that are really ritualistic in the US. We just don't recognize them because it's our own culture. But I haven't seen cultural experience of perimenopause and menopause really written about elaborately. There may be books out there that I'm not aware of, but I think the last maybe 2 to 3 years is where the topic of perimenopause and menopause has really started to crack open. And I'm
Yeah.
sure those books are being written right now, and maybe there are some
Yeah.
published. But from what I've seen, that in many other cultures, perimenopause and menopause is not really discussed. And even more so, maybe even that in some of our cultures in the US that will say that, women just need to kind of get through it because their mother got through it and their grandmother got through it. And this is just another one of those things that women have to figure out, right? Just like childbirth, just like periods, like this is just another one of those things. And I'd love to learn about a place where it's discussed more.
Yeah, that's amazing that you have the contrast. You studied, women health, but at the same time you have anthropology. I also studied anthropology. That was
Oh,
my
cool.
major. So we
Oh,
have that
nice.
in common. So we love
Yes.
people. We like to
Yes.
learn about others. And I love the idea of the party, period
Thank-
party. Maybe we can have a perimenopause party. What
That
do you
would be great. That
That
would be
would
great.
be really great. So that's why we're doing this because we want to change
Exactly.
the
Yeah.
perspective of women. Jokes aside, what are some of the common symptoms women experience during premenopause that often go unrecognized or misunderstood?
So I think when menopause is discussed, especially in the media, or if we see a TV show, right, or a movie, when it does come up, it's usually discussing hot flashes or mentioning hot flashes. And people talk about hot flashes or night sweats. And somehow that has become the most acceptable experience of menopause. However, we see very, very commonly mood changes, whether that's depression, anxiety, just emotional lability. And I think that that's probably more common because that's what I hear from my patients. And they tell me they don't feel like themselves and that, kind of sneaks up on them. It starts off with the first week before their periods, and then it kind of starts to permeate through the rest of the month as they get closer and closer to menopause. But I truly think that the mood disorders and mood changes is probably the most common symptom, and that we will figure that out soon. But again, that's like we're talking about a taboo within a taboo, right? So
Yeah.
mental health in North America is even more of a taboo than just women's health. So if you have mental health and women's health together,
Yeah.
so that it's going to be even more stigmatized.
Yeah.
And it's way easier, I think, for my patients to say, hey, I'm having hot sweats, they're bothering me. Is there treatment for that? Than to say, I feel depressed, I feel anxious. What can I do for that?
We don't say that out loud, but it does impact us and it confuses us.
Yeah,
And
absolutely.
I felt that feeling of feel like myself, like a less patience.
Mm-hmm.
I was so not patient with my husband, with the kids, and I was like, "What's going on with me?" Sometimes I would find myself screaming,
Mm-hmm.
and I'm like, "Happened," because I normally don't do that, right?
Yeah,
So
absolutely.
it's very
I think
disturbing. And then if I don't know, I don't know. Just
exactly. And
me.
I think we lose our reserve. I think like there's a little bit less reserve there. So, for any listeners, or if I feel like you can think of these like PMS days before your period and you just feel more irritable and you might have slept well, but you kind of feel like you didn't sleep. right? And it's like, like that grouchiness that anybody might have if they didn't sleep well. And then you start experiencing that for more days out of the month than you don't. And maybe you are starting to struggle with sleep because insomnia creeps in, night sweats creep in, and then that really takes away someone's reserve. And then you don't feel confident at work because you're getting hot flashes or you're having any other like joint pain, skin changes, all these other things start to change. And then I think we lose our reserve of being able to cope. And if we're not aware that this could be all hormonal and this could be perimenopause, then we will let it go untreated or I guess unattended to until we hit a place where we have to do something.
Especially if you never heard of it, it's very, very strange. And then,
Mhm.
you can blame it on yourself.
And not
It's
to mention the
good
other
that we are talking
stressors
about
that
this.
right? It is good, right? We have to. Not to mention all the other stressors that women in their midlives are under. So I see women, whether they have children or not, they may have a high-powered career that puts pressure on them or stress on them. They may have
Yeah,
children that they're trying to raise, and in
yeah,
the world today, that's also a whole very scary thing, a lot of stress, right? And then a lot of my patients, they start to have parents who are aging and they become the caregiver for them. And so you imagine your parents, your children, the world right now, and your job, right? And then
yeah.
you have no reserve, you're not sleeping well. I mean, gosh, like
That's a lot of pressure on our
it's a lot.
mental health.
It's a lot.
And since you're a doctor, we
Hmm.
know what the symptoms are, but what is going on in our body that is making us
Yeah.
crazy like that?
Absolutely. So what is happening is a roller coaster. And that's what I tell my patients. And that's why perimenopause, I think, is so much harder for so many women than even menopause. Because in menopause, you actually then have a much lower baseline estrogen, testosterone, and progesterone. And you might have those symptoms from it, but you're not having the fluctuation. And so in perimenopause, what's happening is our eggs that are in our ovaries are slowly beginning to degrade to the point that they die off. And those eggs were previously creating the estrogen and testosterone and progesterone. That whole ovarian complex is creating those hormones. So as it kind of degrades and is dying off, then we produce less of those hormones. But then every so often, a bunch might shoot off at once
Yeah.
and give us a little surge,
Oh my goodness. Yeah.
and then we drop again. And so it is literally this up and down. And like, okay, I was feeling bad, but now I'm starting to feel better and I'm okay. I'm all right. I don't need help. I don't need to make a doctor's appointment. And then you fall again. Okay, I got to get in with a doctor. And then you're doing
Roller coaster.
yes, it is a roller coaster.
Yeah.
And then with all the other life stressors, like I could speak for myself. I don't have time to see the doctor. I don't have time to see a healthcare professional. Like it really is challenging. And I don't even know how my patients make it into me. I try to make things as available or accessible to people as possible. But right now in my life with young children, I can't do weekends. I can't do evening, appointments. On the weekend, every few months I do a menopause retreat with my colleagues. And so that is a way I try to bring people in accessibility wise. But honestly, I don't know how my patients do it because I personally can't do it. It took me months to get in with a primary care doctor. It's tough. It's very tough.
It is very tough. So you painted a picture. So because it's like the roller coaster. Also, I never went to a doctor for this because
Mhm.
I feel better in between. And I'm like,
Yes.
maybe I'm okay. I'm okay. And then until it goes
Exactly.
down again and very strange and it's maddening and it's almost
Yeah.
sometimes, you feel like
Yeah.
you're going crazy and
Yes,
we're not
exactly.
making this up. There's actually something going on in our body.
Exactly. Yeah, the best thing I can tell people to do is to use a period tracker. So if you think you're in perimenopause and still having periods, so just to be clear, menopause is when you've gone a whole year without periods. But in perimenopause, you're probably still having periods, or if you had a hysterectomy, your ovaries are still functioning to kind of give you a cycle, even though you're not bleeding. But if you can track your symptoms, that is very helpful so that you can start recognizing those patterns.
Right. And a lot of us, I mean, if we don't talk about women health, and some of us we're not even tracking. We're like, okay,
Yeah.
comes and goes, don't talk about it,
Yes, and that's the
but
thing.
it
If something
helps.
only happens for 1 week out of the month, you might be all right, right? But then like it starts happening for 2 weeks out of the month, and then you can't get in to see someone for 3 to 6 months.
And there's irregularities, right?
Correct.
Some women may have it like every 2 weeks, or
Mhm.
I know women have talked to me about, not having it for 3 months and then they would have it. There's a lot of irregularities that happen.
Exactly. Yeah. Bleeding changes can also be a big sign for perimenopause and getting close to menopause, where you might start skipping periods. And as you skip periods, the lining of your uterus might build up, build up, build up, build up. And then when you have a period, it might be really heavy, or you might just start getting more frequent periods. Again, just imagine these ovaries. Like I kind of think of them as like fireworks. And, sometimes you get like a firework that's a little bit of a dud and it doesn't really get
Yes.
there, right? And so that's kind of what's happening sometimes. Your ovary is trying to release an egg as part of ovulation, and you might not have an egg that makes it. I like to kind of simplify it.
Oh
And
my goodness.
yeah,
It's beautiful to be a woman, but there are
right?
tough times that,
Absolutely.
you're like, oh my goodness, one more thing on my
One more
on my
thing.
list to deal with.
Yes, one more thing.
When it comes
Exactly.
to the age, someone told me the other day we were talking about it, and she said she started very early, like talking about 40. So,
Mhm.
is there a time that a woman goes through this period, or
Yeah, so
different?
there is a range, and I try to tell people it's kind of like puberty. Not everybody gets their period at like 12, but on average, girls get their period at 12 or 13. And so there's a little bit of a range. The average age for menopause is 51 or 52, somewhere between there. And then perimenopause can start as early as 10 years before. So really women in their 40s, that's my most common patient. But I do have patients who are in their late 30s too, right? Because if you maybe are on the early side of the average and you're going to go through menopause at 48, then 10 years prior is 38.
Right. Yeah,
Mm-hmm.
that's very early.
Mm-hmm.
Yeah.
Yeah, there is some correlation with our mothers. So it is helpful to know kind of what your mother's experience was.
Yeah.
So, not everything works that way for
Yeah.
women, but for menopause, it tends to. So that's helpful to know.
So, does that mean women can go through perimenopause at the same time can be fertile? Like they can have babies?
Yeah. So they're still
Really?
fertile. Mhm.
Okay.
And sometimes there's an uptick in fertility. There's an author who actually interviewed me among other physicians about this. She's got a good article about it I can send to you, of like all of
Oh,
the
yeah.
sort of accidental pregnancies that women have in their 40s. And they might have been trying, they might have gone through fertility treatments earlier, but then just because of that same reason of the ovaries trying to kind of recruit all the good eggs and trying to find a good egg to release, like there actually can be almost a temporary but renewed ovarian function. And so I have patients who think they're 45 and they're too old, they're not going to get pregnant, but they still can. So we still do recommend contraception. And if you are going to use hormone therapy during that time, which is you can, just have to make sure that you have contraception as well. For my heterosexual couples, I really encourage women to ask their partners to have a vasectomy. They can just take one for the team.
Oh, wow.
And then the woman can, deal with her perimenopausal treatments and not have to worry about contraception.
That's really amazing because I can't imagine going through perimenopause symptoms at the same
Yeah.
time, then getting pregnant and dealing with that.
Exactly. The likelihood decreases, right? So, like, as we age, our eggs age, and so the quality of them is not as good. So, it's possible people can get pregnant and then it ends in a miscarriage. Like, that's the more likely, but
Yeah.
just even going through all of that.
Yeah.
But I have a lot of patients, and probably even myself, to be honest, who had children in their later years. And, my third daughter, I had her when I was 39. And so I feel like a year later, I'm postpartum for that first year afterwards. And then I'm 40 and starting to go into perimenopause. So it's like a lot of women really go, I think, at least in the US now, from postpartum right into perimenopause.
Wow, you just scared me when you said 39 because you look like, you can pass for 28 or
What?
something. Very
No
young.
way.
What are you
Oh my gosh.
talking about?
No, no, no. I'm 40.
Oh my goodness, seriously. There must be a secret that that's for another day, like
Yes,
another
I'll
interview.
tell you. I'll tell you.
Okay. So I want to change gear now and talk about the social impact this
Yeah,
has in relationships because there's a lot of stuff that goes on for the woman, and
yeah.
if the woman is not stable, that impacts everyone.
Oh,
So,
yeah.
what are some of the impacts this causes for the family, the community, and the society in general?
I can't tell you how many of my patients and the women that I've met at our menopause retreats who have told me either for themselves or people they know who have actually gone through divorces at this time because they start to have the like emotional struggles and their partner doesn't recognize them anymore or is not supportive, or it just kind of pulls them apart. And so do see a lot of separations and divorces among this population, and I believe there's larger population statistics to back that up. It could also be the time, I do have patients who their children are going to college and now their partners and them are on their own again, and they're looking at each other. Do we still know each other after all these years of like, raising these
Yeah.
kids? But I think the perimenopausal changes don't help. Also, we see like sexual function starting to become impacted by perimenopause and menopause, where women experience vaginal dryness and pain with penetrative intercourse, and they might have decreased libido, either because of the pain or just naturally as their testosterone levels are getting lower. And so that can put a strain on relationships. So I do see these like romantic relationships and commitments that can be really strained, especially if people are not recognizing what's happening and not getting treatment. It only makes things harder.
That's tough because, like, if I'm screaming and you've never experienced me like that, then you're like, "Do I know she has
Yeah.
changed?" Right?
Yes, exactly.
She
Exactly.
might even believe it.
Yeah, exactly, right? It's that same
Yeah.
thing, like the same as the women that I took care of in Malawi, like both just blame themselves when they don't have another explanation for it.
How can, I mean, this is not good. Like when the
Mhm.
divorce rate is high because of that, when we can actually, we're doing that, we're putting the light on, per se,
Mhm.
and so
Mhm.
that people can understand, oh, maybe,
Yeah. Yeah.
what are some of the things that the men can do, or
Yeah.
maybe people around the women can do
Mhm.
during this
So
period?
I love this. I love that you're asking about this because I did an interview with a young man who wanted to know how to like support a future partner through perimenopause. I love that he was asking this. And
Yeah.
I kind of said to him, there's a difference when we say like, oh, it must be that time of the month, right?
Yeah.
Or are you doing okay? Like, are you feeling all right? How can I help you with this? Like, things seem to be stressful or difficult, right? I think being aware is really the first step, but that can't be the only step, because then you could then, if you're aware, but then you're saying, oh, this is perimenopause, you're just menopausal, you're acting this way, and it kind of lets the guy off the hook from thinking
Yes.
that there's anything that he can do about it. And then it again blames the woman. But in difference, if they are aware that this might be happening and they might be experiencing these changes, and they can be supportive and say, I know a lot of women start to experience perimenopause in their 40s. Do you think that has anything to do with what's going on? And should we try to see what we can do to get you help or to get our relationship help? It might not even be perimenopause. It might be that they need couples counseling, right? There might be more to it. But if there is something that's medically related, then I think being aware and supportive is the key.
Is there anything women can do as well?
Oh, yes, of course. So I think tuning into ourselves is so important. There's so much, especially for this, I'm imagining just my average patient who's got kids and parents and a full-time job, and it's so hard for her to actually tune into her feelings and her symptoms. And when I ask her, like, when did these things start? She usually can't really tell me, right? It's just kind of like has snuck up on her. And that makes me realize that she has not been in tune to what's happening in her life, because probably she's been taking care of everybody else, as so many
Right.
women do. And so I would say that's the most important thing, is for women to have this time to, not just the me time, but
Yeah.
the like getting to know yourself and being aware of the changes, whether they're physical or emotional, so that you can recognize when there is a change and recognize the patterns that might be behind them.
Would it help? I know you were talking about women retreats, and I love the idea, and I'm going
Mhm.
to ask you about that and
Yeah.
well, but does it help also for women to be around other women?
Yes, I think so. I think this is the biggest tragedy of our modern time, is that we're all on, on the phone, on email, we're virtual. And like there's so much that's great with that, like doing podcasts. Like I love that we have these
Yes.
sorts of tools that have come out from this like modern technology, but we also have become so distant from one another. And it's very different. I'll give you this example. We tried to do a virtual menopause retreat so that we could allow more access and have women who live farther away to join us. It wasn't the same. It just wasn't the same. First of all, because I think when you attend a retreat in person, you are taking the time to leave your home circumstances, leave everything else, that you might be, just leave that at home. And you are spending this dedicated time for yourself, and you get to talk to people, you get to listen to people, you might throw in a massage. Like there's different things that we try to do to pamper
Yes,
people too, right? Besides talking about what's happening during menopause. And I think that in-person community is what people are craving and what they really need right now.
it is, especially after COVID. I think we have
Yes.
recognized what
Yes.
we are missing in our society, right? That, closeness,
Yeah.
especially.
It's like we don't have that anymore. These
Right.
like communities where you're just being vulnerable with each other and learning from one another.
I love that. I might have to come to one of those
Yeah. Yeah, absolutely.
retreats. You're gonna give us a detail at the end. But before I ask you about practical tools, is there
Yeah.
a difference between, because I represent the Black and Brown
Mhm.
women, is there any difference as far as women getting access to this new information or
Mhm.
to this new way of being that we are creating, being
Yeah.
aware and, changing?
Absolutely. I mean, you might suspect that as we see
Mm.
worse outcomes for Black and Brown women across so many of different areas of health, we see it with menopause too. And women of color experience more severe menopausal symptoms and for longer. And, from a physiological perspective, like why? But honestly, it's probably because of lack of access to treatment. And whether it's access or choice for treatment, it's probably complex. But I think that there is a disconnect where women are not getting the help that they deserve. And there's been some research to show like the pervasiveness of the fear of using hormone medication for menopause because of risks of breast cancer. And so that might keep a woman who's Black or brown and may see that there's a higher rate of breast cancer in her community, and that might keep her from getting treatment. But also, we know that women of color have a harder time getting in with their healthcare providers, have a harder time being believed and heard by their healthcare providers. And they might be given medications that are not as effective, or they might be dismissed more likely. Unfortunately, we see that racism still exists
Unfortunately. Yeah.
yeah, yeah. And I think, I'm not trying to let any healthcare professionals off the hook from this, but I do think that like sometimes it's subconscious and they might not even be aware of it. But when we look at the statistics and we look at the data, we see that it's still there.
That's amazing. Yeah. And hopefully, with the rest of everything that we are trying to repair,
Hmm.
hopefully this will improve as well.
Yeah,
And
I hope
I'm
so.
hoping this will give some
I
women
agree.
like me to
Mhm.
understand and shade the light and
Yeah,
get the treatment they need and advocate for themselves, because sometimes you
exactly.
also have to advocate for yourself, right?
Yes, exactly.
Yeah.
Exactly.
And now I want to go to the fun part.
Yeah, no
Do you
problem.
have a solution for us, please?
Yes, there are lots of solutions. Okay, so there are non-hormonal medications. There are supplements. So I'm part of this group that started a company called MIM, which is a supplement company. And the reason we started it is because so many of my patients were coming into the office with bags of supplements that I know either are ineffective or harmful. And whereas a supplement might not be my first choice of treatment for someone, I know that many women choose to start with supplements. And so we wanted to create a supplement that myself as a healthcare professional and my colleagues as scientists and medical professionals could get behind. And so what we did was we looked through each ingredient that is out there and found which ones had some scientific evidence, some real research behind them, not only in effectiveness, but also safety. And we put them together for a supplement that helps during the daytime and a supplement that helps at nighttime for people who are having night sweats and trouble sleeping. So that is one thing. I'm really proud of that work that we've done with MIM, and it doesn't stop there. I still think that hormonal treatment is very effective. It's our gold standard for women with perimenopausal or menopausal symptoms. So if you are having symptoms including mood changes, hot flashes, night sweats, changes in desire, vaginal changes, skin, hair changes, all of these things that we've been talking about, and you are medically eligible to use hormones, because not everybody is, if you've had a stroke, a heart attack, blood clot, if you had liver disease, or if you have a personal history of breast cancer or ovarian cancer, then it may not be recommended. But if you are eligible for hormones, that's been proven to be the most effective treatment. And if you can't take them, but you still want a prescription medication, we've got some excellent non-hormonal medications that are especially for hot flashes and for sleep and night sweats. And then for other symptoms, we'd have to kind of go on a case-by-case basis of what might be a good option for you.
Can you say a little bit more about the hormone treatment? Because
Yeah. Yeah.
earlier you were saying some women might associate that with breast cancer. Does it?
Mhm.
Is it related to that?
Yeah, so we worry in general about estrogen exposure and breast cancer because so many breast cancers are coming from estrogen, increases of estrogen to estrogen receptors in the breast. And our largest study, which definitely has some issues that we've kind of gone back and forth with a lot, trying to parse out the data, it comes from the Women's Health Initiative that was published in 2002 and showed that increased exposure to estrogen and progesterone, which we take to protect our uterus from the estrogen, is associated with a very small but an increase in breast cancer. And so that was the data that, that's the most robust data that we've had for the last decade. More research is coming out and is continuing to show us that it's a very, very small risk, if any risk at all associated. But in general, we do worry about long-term estrogen exposure, even if that estrogen is coming from our own bodies or from our fat cells, which also produce a different kind of estrogen. We worry about breast cancer and endometrial cancer and ovarian cancer. So those things are always kind of in the back of our mind. But I always tell my patients to give them some perspective. Birth control pills have estrogen in them too. And we don't tell you you can only be on this for 5 years because your risk is going to increase slightly, right? So it's all about perspective. Well, what's the risk and what's the benefit? And for most of my patients, unless they have a gene for breast cancer that they know that they're a carrier for most of them, my patients, the benefit far outweighs the risks. But it's important to see a healthcare professional to kind of identify what are the risks for each individual person and figure out which is the right treatment option for you.
Thank you for elaborating that because we
Yeah.
need to know. Sometimes I realize in the community that I serve, sometimes we hear women talk and then we see that as the truth. And I
Yeah.
always say, you need to hear it from the doctor, or
Right.
you really need to know the
Yeah.
fact. Be
I mean,
scared.
cancer is scary, right? And I get that. And I feel like cancer is a terrifying thing. I don't want anybody to increase their risks for cancer. My sister is battling uterine cancer. This
Sorry to
aggressive
hear that.
form. Yeah, it's like not associated with any of the, estrogen that she was exposed to or anything like that. But I wouldn't wish that on anybody. And so we do want to be careful with anything that we're putting into our bodies. But at the same time, it's all about perspective and what your individual risks are and where you might benefit from having treatment, because we're living beyond menopause longer than we ever have. And I have people who say, why bother treatment? This is natural to go through menopause. But it's really different that we're now spending 40% of our life after menopause. So that's
Right.
40% of our life with low to no levels of estrogen, whereas we have estrogen receptors in our entire body. And so I think it's worth kind of taking a look at if you are medically eligible and you're having symptoms. I think it's definitely worth looking into. The other thing I'm really interested in knowing more about, and I think research is going to continue unveiling this to us, is that we do see estrogen protecting cardiovascular health, bone health, brain health, if it's started at the right time before all of these issues might start popping up for people. And so it's about starting it when women are starting to have symptoms or starting to go through menopause. And I feel like if we know that we could be preventing cardiovascular disease, which is actually the number one killer of women and the number one killer of women of color, especially, then wouldn't we do something to try to prevent cardiovascular disease? And so there's this balance of how do we stay healthy? How do we protect ourselves from the biggest risks for ourselves while not bringing on something else?
That's right. And I love that because you gave different options. It's not like
Mhm.
it's only one solution, that there
Right.
there are options. And
There are so many options, but the only
yeah,
option I don't recommend is suffering in silence.
yes. I love that. No suffering in silence.
Yeah.
No, for us, because
Yes.
actually I think the one thing that cannot be silent is perimenopause, because you would be going crazy.
Yeah. Yeah. Right. I know we're not silent.
I've been silent for a long
So
time.
long.
Now I'm like, It's gonna pop out of me.
Yes,
Uh,
exactly,
Yeah.
exactly.
So people can choose to have a hormonal supplement or
Yeah.
hormonal treatment and medication for hot flashes.
Mhm.
And we were talking about that. And then you mentioned earlier about retreat. What is that? Also, is that a solution? Is that a support? Is it to empower women? Can you tell us more about that? Is that also a support for the woman to
Yes,
empower them to go through whatever she's going through while she's
absolutely.
taking care of herself?
Absolutely. I recommend everybody to, if you're not going to come, to one of our retreats, to get together with your friends and talk about it because chances are someone that you are close to has either already experienced this and figured some solutions out that might help you or is going through something and really needs your support. And I think this is one of the things that it's so easy for us to live in silos and deal with our own stuff. And this is one of the times where we need to reach out to one another and help one another. And so I do think that being in community is treatment. And I think coming to a retreat and spending the time for yourself to learn about what is happening, to learn about your options, that's also treatment for you.
It is. I love the holistic approach of it, right? You're
Thanks.
taking care of yourself, but you're also surrounding yourself with women and you're learning at the same time and you know that you're
Yeah.
not alone.
Right? Like, I mean, as you studied anthropology, like we are social beings. We are
Oh,
not meant to be experiencing life on our own. And so we need to lean on each other. And this is one of those times.
that's wonderful. And where do you hold these retreats?
The retreats. So we do them throughout Northeast Ohio because that's where we're located, but we are open to travel. We've been talking about kind of going to a few different places. We did go to Pittsburgh a couple of years ago. And if there's a group of women that are interested in having us come, or if there's a company that wants us to come, then we're open to doing that.
That is awesome. And
Thank
I
you.
hope you come to California.
Yeah, we would
We
love
can
that.
see each other in person and we can have
Yes,
more time talking about this and not
absolutely.
be. And if you ever come this way, let me know.
Yeah. Oh, thank you.
And
Thanks.
can you tell me about the supplement also?
Yeah. So the MIM supplement is something I'm really proud of because basically supplements are not regulated by the FDA. So they do not have to be shown to be effective. They don't have to have the same clinical trials that medications that are prescribed do. And they also don't have to show the same level of safety, which is kind of crazy. They're considered a food. And so you can get them over the counter. And unfortunately, we do see lots of supplements like black cohosh, which might actually help women with their hot flashes, but it also can cause liver toxicity. And so, because of that lack of regulation, I have patients who are taking lots of different supplements. So, the MIM supplement is something that we hand created, hand picked each ingredient to be something where we could find someone had done research on to show that it had some positive effect and that people had done research to show that it did not cause harm. And so, we put the ingredients together of what we found was the most effective for the most common menopausal symptoms. For example, during our daytime supplement, we have something called mango leaf extract, which for centuries, populations in Asia have been using that as a tea. And it's a non-stimulant stimulant. So it really helps women with brain fog. And so it helps them to feel more awake without having the jitteriness or the irritation of their bladder the way caffeine does. And I just love that people have been using this for years in other cultures and I had no idea about it. And then for the nighttime supplement, it's supposed to be calming and to help people to kind of wind down for the evening and also to reduce night sweats. And so the combination, whether you're having predominantly daytime symptoms or both, you could take one or the other. The idea was kind of like a cold medicine. You know how we have like cold medicine for day or night, depending on whether
Right.
be alert or asleep. That's kind of where the idea came from to have the daytime and the nighttime. But so many women who are going through perimenopause and menopause really need both. So we have the bundle available for them.
That's amazing. I ordered mine and it's
Oh, thanks.
coming and I can't wait to
Thank
see if it's
you.
gonna help with flashes.
Yes. Yes,
That's the
absolutely.
worst. And having said that, I know we're gonna put all the information
Yeah.
linked for our viewers and for people who suffer
Mhm.
silently. I don't think it's silently, but
Yes.
for women who are going through this. I just have one more question
Sure.
for people who do not have access to
Mhm.
this. Like for example, someone is listening to this in
Yeah.
Africa and they don't have the access or the means to get a hormonal treatment or
Yeah.
any of the things that we're been talking about. Is there any natural method that they
Yeah.
can take care of themselves?
That is tough. You can find estrogens that are in plants and tofu tofu, soybeans, and chickpeas. Those are like a common place to find them, but you have to ingest a lot of them to start to get the effect. I'd say most of the countries that I've worked and lived in that are even in like sort of low resource settings, there's usually a pharmacy where you can get treatments. You just have to be careful to make sure that you know what your medical, any sort of risks might be, and to know, that somebody is kind of guiding you on how much to use for what treatment. But I have seen estrogen pretty much everywhere. And so I feel like that hormone at least is accessible in most places. It's really hard to get enough from diets. You definitely can do the pattern tracking, try to see what's happening and when, and you definitely can do the community sort of working, talking to people, trying to find out what's worked for them, what's helped for them. That can be done anywhere. But otherwise, I would still try to get some guidance from a healthcare provider and see what you could get at your local pharmacy, because I bet it's available. Yeah.
This gives me a lot of hope for the future.
Yes, absolutely.
I know it doesn't feel like a lot, but what you do is very important. And thank you for what you do
Thank you.
for the world. What's one thing that you want to say to every woman, every man who would be listening to this
Yeah.
about this life stage?
I would say the more education and the more you can do to normalize it, the more you're going to help people. Because if we know to expect this and we know that there's treatment that's safe, then women won't have to go through it. And so, just like any other normal part of our life, it's just another stage and it will pass, but not suffering through it is going to make your life better. So whether you have a sister or a mother or an aunt or your wife, or you're a woman yourself, this is going to affect you. And it's better to go in with your eyes open.
Thank you so much, Rachel, for coming and giving us this invaluable lesson, giving me hope, and many women, I'm sure, hope that we can actually have some kind of control over this.
Thank you.
Life. Thank you so much for coming.
Yeah, thank you too.
Until next time. We can talk about menopause next time.
Yes, we can do that.